Trigeminal neuralgia, also known as the fifth cranial nerve, is one of the largest nerves in the head and is responsible for transmitting sensory information from the face to the brain. When functioning normally, the trigeminal nerve helps us sense sensations such as touch, temperature, and pain in these areas. However, in the case of trigeminal neuralgia, the nerve can become overactive, causing extreme sensitivity and pain. This painful response is often triggered by everyday activities such as chewing, talking, or even feeling a breeze. Trigeminal neuralgia is often caused by compression of the trigeminal nerve, usually due to nearby blood vessels rubbing against the nerve root. This constant pressure wears away the protective covering around the nerve, causing erratic, overstimulated nerve signals. As the nerve loses its insulation, everyday sensations are interpreted as severe pain. Other potential causes of trigeminal neuralgia include tumors, cysts, or other abnormalities in brain structures that compress the nerve. In some cases, multiple sclerosis can cause trigeminal neuralgia, as the disease also damages the protective covering of nerves, including the trigeminal nerve. People with trigeminal neuralgia often describe the pain as sudden and intense, coming on without warning. Triggers vary from person to person, but common triggers include: movement of the jaw while eating or talking can trigger pain. Slight movement of facial muscles while talking can also cause sharp pain. Even the lightest touch, such as washing your face or applying makeup, can be very painful. Trigeminal neuralgia is a difficult condition to diagnose because it can resemble other types of facial pain, such as dental problems or sinus problems. Many patients undergo unnecessary dental procedures, such as root canals or tooth extractions, before receiving an accurate diagnosis. A thorough clinical examination by a neurologist, often supplemented with imaging studies such as magnetic resonance imaging, is essential to rule out other causes of facial pain and confirm the diagnosis of trigeminal neuralgia. During the clinical examination, the neurologist will typically assess the pain pattern and perform a neurological evaluation to determine if the trigeminal nerve is affected. If a tumor or vascular compression is suspected, imaging studies such as an MRI or CT scan can provide detailed images of the brain to help determine the exact cause of the nerve irritation. Treatment of trigeminal neuralgia focuses on reducing or eliminating the pain. The most common initial treatment is medication, and in many cases, patients experience pain relief with medication. The first line of defense against trigeminal neuralgia is anticonvulsant medication, which is often used to treat epilepsy but also helps stabilize nerve activity. The most commonly used anticonvulsant medication for trigeminal neuralgia is carbamazepine, which has been shown to be very effective in reducing pain by suppressing overactive electrical impulses in the nerves. Carbamazepine works by blocking sodium channels in nerve cells, thereby reducing the ability of nerve cells to send excessive signals to the brain. While this medication is effective for many patients, it can also have serious side effects, including dizziness, drowsiness, and nausea. While medications can provide relief for many patients, they are not a cure for the disease, and over time, some patients may find that their symptoms become resistant to medical treatment. In these cases, surgical intervention may be considered. Although trigeminal neuralgia is a condition that primarily affects the nervous system, its effects can ripple into many areas of a sufferer's life. Therefore, coping strategies and support systems are essential to improving the overall health of those affected by this condition. Many people with trigeminal neuralgia find that adopting certain lifestyle changes helps reduce the frequency or severity of pain attacks. These changes may include changing their diet, learning to manage stress, and incorporating relaxation techniques into their daily lives. For some sufferers, the simple act of eating can trigger severe pain, especially if the branch of the trigeminal nerve that controls the jaw is affected. Hard, crunchy, or cold foods may exacerbate symptoms, so many sufferers switch to softer, warmer foods to avoid triggering pain. In some cases, avoiding foods with specific textures or temperatures can significantly reduce the likelihood of painful attacks. Switching to soups, smoothies, pureed vegetables, and other soft foods can help avoid vigorous chewing. Cold or hot foods and drinks can exacerbate trigeminal neuralgia, so many sufferers prefer to eat at room temperature. Since it can be difficult to maintain proper nutrition when eating in pain, focusing on nutrient-dense, easy-to-eat foods ensures that sufferers are getting essential vitamins and minerals. Additionally, patients can choose to eat smaller, more frequent meals instead of larger ones, which can reduce the time spent chewing or opening their jaw. Sleep disturbances are common symptoms for people with trigeminal neuralgia. Pain attacks are often unpredictable, including during the night, which can disrupt normal sleep patterns and make people feel tired and frustrated. Lack of sleep can also make pain worse, leading to a vicious cycle where pain and sleep deprivation exacerbate each other. To improve sleep quality, people may need to develop sleep hygiene habits that promote relaxation and help control nighttime pain. Performing calming activities before bed, such as reading, listening to soothing music, or practicing relaxation techniques, can help signal to the body that it is time for bed. Caffeine and blue light from screens can interfere with the ability to fall asleep. Reducing exposure to both of these substances a few hours before bedtime can help improve sleep. Taking prescription medications to control nighttime pain can improve sleep quality. Additionally, some people find that sleeping in a slightly elevated position or using specific pillows can help reduce pressure on the nerves and prevent pain.